Dr. Shivalinga Swami Salimat, Consultant, Department of Pulmonology, Critical Care and Sleep Medicine and Interventional Pulmonology. Chronic obstructive pulmonary disease, famously known as COPD, is a group of lung conditions including bronchitis and emphysema. This is a condition which makes it hard to breathe and makes it very hard for the air to go in and out of the lungs. It is a chronic lung disease as described as chronic, obstructive which causes there is airway narrowing, pulmonary which involves lung, and it is a medical condition causing problem in the lungs. Well, here bronchitis means there will be mainly inflammation and narrowing of the airways, wherein you produce lot of sputum and phlegm and they will have lot of breathlessness. Emphysema means there is damage to the air sacs at the end of the airways, wherein gas exchange happens and which is also hampered. So these two processes, bronchitis as well as emphysema, make it harder for air to move in and move out of the lungs, and it also hampers the oxygen intake as well as to get rid of the carbon dioxide. COPD usually develops on exposure of lungs for long term to harmful substances like smoke, especially cigarette smoke, over a long period of time, and also smoke or fumes from other sources like industrial exposure as well as dust. In India, basically women especially living in the village areas, they get exposed to lot of biomass fuel. This also leads to development of COPD. So COPD is diagnosed first based on the history of shortness of breath, long-term cough, sputum production and weight loss and loss of appetite, etc. At the same time, we do certain investigations like spirometry. This is a test which involves blowing hard through a machine which will record the lung functional capacity, and it will say how severe is the obstruction or how severe is the narrowing of the airway which has taken place because of the disease. The main treatment of COPD is use of inhaled medications. So we use many inhaled medications, bronchodilators which help in relaxing your airway muscles and dilating the bronchus so that you can breathe easily, which will relieve your breathlessness symptoms. Or in case of acute exacerbation, we use inhaled corticosteroids also, which will reduce the airway inflammation and helps in treating the disease. Bronchodilators as well as steroids, they come in combination or they are given separately. So when there is a flare up or an exacerbation of COPD, when there is lot of phlegm, we also use certain mucolytics in the form of tablets or syrup, which will help in thinning out the sputum, and it makes it easier for you to bring out the sputum and clear your airways. So in smokers, prevention of smoking is the most important thing. This will definitely aid in getting an effective treatment. The key to the effective management of COPD is regular and proper use of inhalers in the right technique. Some patients are advised to use oxygen when their blood oxygen levels are low. Patient can use ambulatory oxygens when their oxygen levels are low whenever they are active, and patient are even put on long-term oxygen therapy when their resting oxygen levels are low. Some patients are even treated with non-invasive ventilation, where this helps in reducing the effort put for breathing, as well as it also helps in getting proper oxygenation as well as getting rid of the carbon dioxide. In case of severe COPDs which doesn't get resolved on use of high dose medications, also NIV and on oxygen, surgery also comes in a role, wherein few patients are subjected to lung volume reduction surgeries, wherein a diseased part of the lung is removed, which makes the healthier part of the lung to expand well and make it more easier for the breathing. So these surgeries are done either from transthoracically, a part of lung is removed, or endobronchial approach is also there. So if you have severe COPD, other than using inhaled medications, doing regular exercises, keeping yourself active, maintaining your body fitness is the most important part of managing your COPD very effectively. Pulmonary rehabilitation helps you in getting rid of breathlessness, also helps you make your quality of life much better along with the medications. This program also involves not only doing exercises, also helps to manage your stress, helps to increase your stamina, helps to increase your exercise capacity. It is recommended for all COPD patients influenza vaccination done once in a year to avoid severe flu infections. Also, get your pneumococcal vaccination, which you may have to take once in lifetime.